I just want to give you a quick hit on sudden cardiac death. All through my training, I've known from the very beginning that the number one risk for all of my patients, men and women, is heart attack. And that's what takes out more people in our country than anything else. Cancer's been inching up and it's real close, but it's still sudden cardiac death or cardiovascular disease. I've been told, and this has been proven, that the first sign of heart disease in men is sudden death. More than any other sign is sudden death. So, wow, this article proved that 53% of men who had sudden death didn't do anything about their symptoms. They had symptoms. There were ways they could have known. So sudden death, maybe not so much. Maybe it was actually within the month before the heart attack. Number one problem, chest pressure. Most men who have chest pressure, it'll get better. It's a little indigestion, it'll get better. If you're in that age range between 40 and 100 and you have chest pressure and it's not something that you're familiar with and you haven't had worked up and you're having chest pressure, you need to get seen. An EKG is reasonable. A stress test is great. A coronary CT scan, where they actually put your body into a CT scanner and they do a quick scan of your heart and they check for calcium. It's a coronary artery calcium score. They'll look at that. It's the most predictive study of all of whether or not you're going to need to be treated for prevention. And it'll also tell you about your risk of cardiovascular death. The stress test goes right along with that. If you don't see your doctor about this subtle, it's just chest pressure, how bad could it be? Sudden cardiac death is at risk. Dizziness and fainting and other symptoms, very, very low on the scale. But if you have any chest pressure at all, and you have any reason to believe you might have cardiovascular disease, anyone from really even younger, 30-year-olds with a family history, 40-year-olds all the way up to really, really old. If you have chest pressure, get it checked out. There's doctors all over, all around you who are well-trained to help you understand this. A stress test and a coronary artery calcium score, and you'll be in the clear. Make sure you get with your doctor on this stuff. If you have any symptoms at all, we're better together.